Good morning, good afternoon, good evening, depends on when you're watching my video. Assistant your resource person was done Wokike. I'm trying to bring a fresh topic into the table today. And what is this topic all about? The topic is trying to discuss about the treatment methods or modalities used in the psychiatric and mental health medicine or nursing. I told you before that that nursing is defined as the practice of medicine. The practical aspect of medicine is called nursing. That is my best view of clinical definition of what nursing is all about. That is my uncle. Put me right. Believe you me. But now, based on my clinical experience, there are modalities that I have been able to apply considering my experience and wide view and long time clinical practice in nursing care, or let me say in nursing a psychiatric and mental health patient or in the care of a psychiatric and mental health patient clinically before going into the educational purview of that same field. But let me outline these following treatment regimen. We have what we call the chemotherapeutic method, which is popularly known as drug use method. But before I go into the sorry for being distracted, I want to first of all classify the treatment of a patient with psychiatric problem into physical or somatic method and non-somatic method. Somatic method, I mean, is touching the individual or using anything that comes close to the patient without, you know, using another way to modify the individual behavior, but trying to apply either a subject, either a particular object on the subject, that is on the patient. For instance, placing some treatment equipment like ECT on the body of a patient, resentment and other things, but I'm going to outline it gradually. But I want to tell you that we have one somatic method and non-somatic method. Non-somatic is talking to patients or using behavioral approach in order to change the behavior of the patient, like psychotherapy, educational therapy, and other methods known as diversional therapy or activity therapy. But now I want to go straight to the point. One, we have what we call the chemotherapeutic method, which is called drug use in the treatment of a patient with a psychiatric illness, or you can call it pharmacological method. This is used the make use of drugs or pharmacological agents or in the treatment of a patient with psychiatric problems. And this discovery was as a result of the scientific history or evidence of the cause of mental illness, trying to relate it to the dopamines and let me say the monoamides or the neurotransmitters as the basic cause. So looking for how either to increase the neurotransmitters in the in the in the post synaptic receptor pathway, or let me say in the postsynaptic left, or trying to open the receptors, or trying to fight on the particular enzymes that decarbonize or that participate in the uptake of these released neurotransmitters. So in this aspect, they were able to, bring drugs into the purview of treating patients with psychiatric illness. Then we have another method now, psychotherapy. You see that drug is more of somatic because the drug must interact with the body, which is called body drug interaction. There you can talk about things like pharmacodynamic and pharmacokinetic. The body must interact with the cells or with the body in order to make sure there is effect. And this is within 2 to 6 months. Within, 2 weeks, there should be an evidence to the level of 6 months. There should be an improvement. Then let's go again into another aspect known as the psychotherapy. Psychotherapy is just like a treatment method where an individual is being, given a way of using talk. Let me use that particular method in order to bring out an individual that is in a psychological problem. For instance, they call it talk therapy or psychotherapy is more of the treatment of the mind of an individual that is being disordered using the oratory method or using using speech way in order to bring the individual by talking to the individual, which goes into one. We have the formal or the informal. The formal is talking about advice, counseling, can talk about suggestion. Yes, I know about that. Then, but where the formal go into where a trained psychologist or a psychiatrist or a psychiatric nurse is being specialized or go undergo a training on psychotherapeutic treatment of a patient, and this treatment must make sure that it is directed, which is goal directed, and the individual must take time. If it is in between section by section, it can be individual psychotherapy, group psychotherapy, considering the conditions on ground. There can also be family-related psychotherapy, what we call family section in psychiatry, where you see that the problem of that individual is family-oriented. You can use that pattern. We still have some other training specialized way of treating patients using psychotherapy method, which is also psychoanalytical method, which was discovered by Sigmund Freud. We have cognitive therapy, we have cognitive behavioral therapy, we have behavioral modification method or behavioral therapy. So we still have some other psychoeducation. We still have independent, we have what we call interpersonal and interpersonal psychotherapy. All these are more of, they are more formal ways of psychotherapeutic method. But I'm not talking about psychotherapy, which is a course we're going to talk in a deep aspect or going to deep of it when the time for it comes. Now I want to talk about another method known as restraint method or restraint modality. This is process of using some restraint materials, for instance, shackles or straps. Then it was used by chain, trying to immobilize that individual by applying those restraint materials on the limbs of that individual in order to make the individual not to move. So when you want to immobilize an individual, you apply restraint materials, either in the ankle, between the leg or in the hand, so the individual cannot shake again. Then in this restraint also we have a way that is being divided into one. We have the chemical method, which is the use of drug and restraint. We have physical method, which is the one that I'm talking about, using materials in order to chain the person as a charcoal or as straps. Then we still have the one they call psychological restraint, that I can talk to the person will calm down. But this is only used if the individual behavior is beyond control and it must be prescribed. And if it is not prescribed, the chief nursing in charge, if UALers, must be aware within an hour. Then the doctor in charge of the patient must be alerted before to now, go beyond. But remember, these have become an obsolete method in the treatment of patients with psychiatric condition, unless if the behavior of the individual have turned to threat to the caregivers, the relative, and other patients. But there is a formal way of doing it, and it must be guided by the principles or by the rules and regulations or guiding ways of prescribing this particular method. It is obsolete, as I said, so it has been obsolete. also used as a last resort. Then we still talk about what we call circulation. This is the ability of removing a patient that is trying to, desensitize, or this desensitizing an environment by removing a patient that is turning to a threat to the general public or the entire patients in the world, putting him in a place known as the seclusion room. This place is a padded environment, a small room that have an opening above where the nurse that place the patient under particular restraint can always be observing the patient within minutes, and make sure you also interact with patients so that the patient will not feel fast circulated, because you also use what we call obstructive and unobstructive method in terms of trying to observe if the patient behavior is becoming obstructive, because some patients can be hitting their head trying to commit suicide. That's why they pad the wall, call it circulation method. We still have another method known as electroconvulsive method. What is electroconvulsive method? It's talking about trying to use a saline pad electrode and apply it on the temporal lobe of the individual, where it can either be modified or it can also be, that of straight. So modify is the application of things like let me call the anesthesia or anesthetic agent when you want to apply it. Then the straight method is not modified. It is the use of non-anesthetic agent in trying to, apply that electric shock on the patient to now induce a shock or seizure in the temporal lobe of that individual. And remember that the seizure point of an individual is within the temporal lobe. And when this occurs, it is either used in a special room or call it an ECT suit. And there are responsibility of a nurse before, during, and after this particular therapy. And remember, this therapy is a therapy that when giving it to a patient, you must exclude the patient from anything food before doing this. We'll talk that into detail later, but know that we have a modality in the clinical method known as electroconvulsive therapy method, which is called ECT. We still have another method known as heliotherapy. Heliotherapy or light therapy is the use of light in the treatment of a patient that has an emotional problem. Like we were able to undergo a study that showed that there is a correlation between light and the emotion of an individual. And this particular light must be a selective light. And there's also a research that was carried that when treating an individual, you must make sure that you off light for an individual to sleep well, to enable a particular pineal release or melatonin to be released, which will help to induce that individual into a deep sleep. And after that individual sleep well, there will be the release of endorphin, and the individual will look more refreshed and more brightened. So I want to tell you that light have a major role. That's also sometimes when light goes, some people's mood change. When there is light, some people mood get or stressed. So imagine in this part of the country, like Nigeria, where I come from, where light always go and come. What should be the emotional status of such a person or the people living in that area? So it should be things that we should put into consideration. So we see how what we call the surgical method. Surgical method is the use of surgery in the treatment of patient that is having one, remember, an organic problem. For instance, a patient with a condition known as epilepsy. The possibility of using this surgical method and trying to regulate the behavior of that patient is very, very important. So in surgery, we have what we call lobotomy, we have civilotomy, we have amygdalotomy, we have hypocampectomy. So it depends on the area that's affected that can also be severed or be opened. So we have lobotomy and lobotomy. Depends whether you are removing something or you are trying to make an opening. It is usually a laser method of surgery, but this will also be discussed in detail. Then we have another method of treatment of patient known as insulin therapy. Here we apply a regulated amount of an insulin, just like in that of ECT, where you apply a regulated or a control amount of electric current in the individual brain in order to induce it. So here you also apply a control amount of insulin in order to induce coma. And here also it is said that when there is induction of coma, the individual may also come out for his challenge of emotional problem. But this particular therapy has also become an obsolete method of treatment in psychiatry. But we are just bringing it for educational purposes. Then we have what we call activity therapy or diversional therapy. This is either can be an indoor game, can be a form of drama therapy or dancing therapy, can also be like game, playing the ludo indoor or playing football. This is just trying to distract patients, diverting patients' habits from and original habit, more especially those that addict drugs. And remember that a habit that is being repeated for 21 days becomes an addiction. So if that individual is being distracted from that habit of going into drugs and the individual is introduced into a habit that will also release endorphin. Remember, exercise increases endorphin also, and dopamine also is also released during exercise. So the ability for you, even adrenaline can also be released during exercise. So the ability for you to make sure you also bring these particular hormones that plays role when an individual takes drugs and now diverting the individual's attention into what can also bring those hormones, those neurons into play. It is necessary also. So a study was carried out and they now said that it is useful. So they also use what we call warm baths. These ones have been also but can also be used. You can use a good bathing method. It was discovered in the course of the history of psychiatry. So they say that warm bath is also good in order to help and moderate the aspect of the brain of an individual. We have so many treatment modalities, but these few are the ones that have been able to apply. Remember, one is called chemotherapeutic method or drug use or drug method, use of drug in the treatment of patient. We have psychotherapeutic method, we have what we call the convulsive method, we have the circulation method, we have heliotherapy, we have we have what we call the surgical method, we have insulin method, we have activity therapy or diversional therapy. So all these are methods used in treating a patient with psychiatric problem. So we'll be discussing this one after the other as you follow up my video, and I will appreciate. Please subscribe. I remain your resource person, Wokike. Thank you and thank you very much as we all put hands together and solve the problem that is ravaging this nation in psychiatry and mental health digest. Thank you.